Welcome, everyone. It's good to see your names. I'm just going to do a quick intro. I'm going to copy and paste into the chat box the sign in, sign out information in case you'd like to receive CEUs. And my name is Salome. I'm the president-elect. And this is my daughter, Melina, who is president-elect in training. And today we have Sazi Wald, who uses they, them pronouns and is a counselor in Olympia, Washington. They received their Master of Social Work from the University of Washington, Seattle. They have special training and licensure to treat substance use challenges and practice hypnotherapy along with extensive expertise treating trauma, anxiety, and working with transgender folks and transition age youth, early adulthood, ages 16 to 25 and 25 to 40. So with that being said, I'm going to pass it on over. Thank you, Sazi, for being here today.
Thank you so much, Salome. Can everyone see and hear me okay?
Yep.
Brilliant. Good. I'm going to go. Awesome. Fabulous. So I'm going to go ahead and share my screen. PowerPoint decided to stop working today, so that was exciting. So we're going to use a different mode and see how that goes. Can everyone see this okay, or is it very tiny?
Oh, I can see it just fine.
Okay, good. So it's all nice and blown up and good view and everything.
Mm-hmm.
Good, thank you for the troubleshooting. So welcome everyone. To give you a little bit of a heads up, I may not be able to monitor the chat as closely as I would like to. So there will be some time for pauses that I'll make during this in case you want to ask questions or participate in the chat. And those pauses will be coming up shortly because we'll do some introductions. And otherwise, during spots, it's awesome if y'all can give feedback verbally. That's really helpful. This is going to be a presentation that is fairly, I want to say the word busy, but it's not busy. It's like, it's active. So there will be some participation that will be happening in this. There's no test, and hopefully the participation will be grounding and exciting and in good ways. So without further ado, I will go ahead and get started. So thank you so much, Salome, for the introduction. As many of you know, oh wait, I'm not even there yet. Yes, so I am a counselor in Olympia. I also do consulting for behavioral health among transition age youth and folks in the LGBT community, specifically trans folks. And just for all of y'all regarding the this workshop today, we'll try to go about 50 minutes. If you want, you can turn on your cameras. That's always really nice. If you don't want to, that's totally fine as well. If you can make sure that you're muted unless you're asking questions, that would be really helpful. And again, you can totally send questions and comments through the chat or through audio. So we're going to just start out with a little bit of grounding. And with this grounding time, I want you to start to think about this exercise specific to how it's going to prepare you to be awesome in your life. So rather than just like, okay, I'm going to take a break, I want this to, as you do these exercises, to really think about this in preparation for the next big thing to help you make sustainable healthy change, not just for your clients and for your loved ones, but for yourself. So the first thing that I want you to do is I want you to just take a moment and I want you to think about, are you in halt? Are you hungry? Are you angry? Are you lonely? Or are you tired right now? And I just want you to take a pause and consider if there's something that you need to take care of in this moment, or some way to help your body get through some of these experiences and halt. All right. So after doing that little check-in, I like halt, the hungry, angry, lonely, tired, because it reminds me that maybe I am not in a good space to learn or make good decisions if I am one of those spots at the moment. So if you need to grab some food, or you need to scream a little bit, please feel free to go ahead and do so. The next thing that I want to do with you is to just take a moment to relax your jaw if your jaw is tight. Bring some attention to your shoulders if your shoulders are tight. If you have any tightness in your neck, just bring some attention there, not necessarily changing it, but sitting with it. And if you can, I want you to acknowledge any shifts or changes that you feel in any areas of tightness in your body. So we're not changing it, we're just watching those spaces. All right. So now that we've taken a moment to acknowledge where our minds and our bodies and our spirits might be, let's go ahead and shift into the sustainable self-care. So when Salome and I were talking about this workshop initially, we were like, we had a whole bunch of different ideas, and the biggest thing that came out of it is we can't really practice these things unless we're taking good care of ourselves. So today we're going to look at, what is self-care, the history of self-care. We're going to explore what radical self-care is. We're going to do some practice of that, and then we're going to develop an actual plan for implementation. So I'm curious about who you are. If you want to go ahead and put your info in the chat, I'd love to know your names, your pronouns, but I want you to also put a little bit of information about how you are doing as a person. So at the end of the day, what do you think is motivating you? Is there a big challenge that you're facing? And if you can, I want you to end on what was the funniest thing that you've seen this past week. If you want to go ahead and put those in the chat, you can, or you can say them verbally. Yeah, Salome put some information about herself in the chat, and really finding that groundedness in her daughter, both in the challenges and the funniest pieces, right? Trying to keep up with life, and then having those glowing moments of being able to watch her daughter outside, being really important. Awesome. Thank you, Nicole. Really big job managing people. Indeed. and being able to give them, thank you for the opportunity to be able to give them some fabulous techniques. Hello, Laura. Yes, children are amazing. And so is nature, absolutely. All right. Oh, and it looks like I got frozen a bit. Oh, is it Chio? Oh, good. Oh, yes, yes, yes. Do you mind if I share? Do you want to share this joke?
Sure. So I just put the other day in our morning rounds at work, one of the doctors, because we were just waiting for some people, they're like, anyone have any good jokes? And they're like, what did 0 say to 8? Nice belt. So, and she just kind of cracked herself up, and it was a nice moment of levity and connection. So it's nice to find those small moments.
I love it. Thank you. That's great. And hello, Melanie, correct? Am I right?
It's Mulaney.
Mulaney, thank you.
Yeah.
And yay, yes, the sunshine has been super motivating.
Mm-hmm.
And Michelle, yay for the banana. It was fantastic. And oh my gosh, I'm so glad that you're also getting in tune with your values and building up those systems to live by those values. And I too, I have a couple of cats and have very much enjoyed what they do. So regarding who I am, I live on the land of the Nisqually. I'm also more than my resume. So like you all, I have a wonderful family. One of my favorite things to do is play games. So I've been playing D&D lately. I also really love reading, specifically fantasy novels. So I'm reading The Priory of the Orange Tree. So if you're looking for like a queer epic, highly recommend. And I love being able to go outside. I've been going outside again after, like, I'm sure many of you working way too many hours over this pandemic. And so I've recently been able to also practice what I preach and set up some systems in my life so that I can have better boundaries. So when we were looking at what to present on, I have training in lots of different things, and we really, we started to explore the importance of self-care in order to deliver interventions. So when we have things like, cultural humility, client-centered care, goal setting, trauma-informed care, all of those things are great, but if we're burnt out, then we're not going to be providing the care that people, need and deserve. And so it becomes vital for us to not only, learn these skills, but also be taking care of ourselves and be well taken care of so that we can deliver these skills. There's this trope within the healthcare field, especially in the field of social work, that we are superheroes. And what that does is that negates the importance of our personhood. And it negates the time that we need to spend with our loved ones, the whole lives that we have and that we need to have, and puts us in this, it can put us in this culture of just working us, and it's kind of our quote unquote duty to do so. So looking at ourselves as, how am I coming in to be a superhero or a savior, versus how can I start contributing to policies and program changes and empowerment so that we can all live, not only have good work environments, but we can also have lives outside of work. So just an important piece, you are a person. And so today we're really focused on that personhood. Self-care often gets neglected and forgotten within the hubbub of the day-to-day. And we all have so much vision and passion and expertise. And so we need to be able to reclaim that. Because otherwise we become extremely exhausted. So I'm curious, I'm going to put this out to the group. What is self-care? What's your conception of self-care? Where do you think self-care came from? Where are people at with self-care?
I get the sense that it's mostly just, it gets pushed around a lot, like it's your energy levels, it's about being productive at work, and I hear that a lot, but I don't actually see, I don't think that fully encompasses what self-care is and what it can be.
Mhm. Absolutely. What do some of you other folks think about what is self-care, and where did self-care even come from?
I often think about self-care in the context of taking care of myself so that I can be in a place to sustainably continue to do the work of taking care of others. And most often I think of it in terms of, setting boundaries on my time and the things that I will and will not do, because there's always the opportunity to do more. And I think about the trope that you mentioned about us being superheroes, and oftentimes in our multiple disciplinary team, it's the joke is thrown out there, well, the social worker will get out there and they will fix it. And it's said as a joke, but it's also said in a slightly like, but no, if you could fix it, that would be really great. And there's also this expectation of doing some magical things to take care of resolving all of these patients' situations, which is somewhat unrealistic. So kind of for myself and the rest of the team, setting boundaries about what is a realistic expectation of what I can do so that I'm not feeling like I'm letting down everybody.
Mm-hmm.
Yeah.
Yeah, thank you. Oh, wait a second. Let me just look in my bag and see where the button is to end oppression real quick. Just one moment. I was given that button in grad school, right? Like we can't solve these huge things. Any other people have ideas about self-care and where it came from? All right, so self-care, as many things, is a radical act of caring for one's own well-being. Self-care, like many other great things, came out of writings and speeches of women of color. The term self-care has been accredited to Andre Lorde in a poem that she wrote, poem story, that she wrote about her experience with cancer. And as a result, as many of you know, it has been whitewashed and turned into this idea of bath bombs and vacations and breath work. And if you'll notice at the beginning of this presentation, I talked about using these grounding techniques not as like just a respite, but as a next step to building more sustainable systems of being present. There have been several other feminists that have influenced the idea of self-care over time. And it's vital that we give credit and get back to the roots, because unfortunately, It was just self-care. It didn't even have to be radical self-care. So now we have to talk about radical self-care. I love this quote. Caring for myself is not self-indulgence. It is self-preservation. And that is an act of political warfare, right? The systems, the powers that be, do not want folks to thrive. Then we don't need to pay for something that we don't need. We don't need to try and rely on people that are oppressing. We don't need those things if we are thriving and succeeding, which means that by thriving and succeeding, not just climbing up a corporate ladder, but relaxing and enjoying and being present, those are things that are innately anti-capitalist. I just wanted to look at this comment in the chat. Yes, Michelle, love this comment about putting families first in that family, within the family systems, and how easy it is to think that taking care of ourselves ends up being selfish. Yeah, that's awesome. Thank you. So what does it mean to be radical? Does anyone know what radical means? Anyone have any ideas? What does radical mean to you?
Maybe outside the box, doing something that is outside the norm.
Mm-hmm. Mm-hmm. So radical is very simple. In its initial term, it just means of the root. So by practicing quote unquote radical self-care, we're getting back to the roots of what we need, which is where we are going now. So radical self-care prioritizes your health, it prioritizes your wellness, and it prioritizes your values. I have a meme here looking at, bath bombs and breath work, and, that not really doing the trick, and then grabbing onto reporting my agency for not giving us breaks in order to really create bigger change. And, this culture that we've come out into, that idea, as you mentioned earlier, Michelle, about, this like having to relearn this assumption of selfishness. I like to remind people that that kind of stuff comes out of oppression and privilege. So, I really want us to consider what type of collective consciousness we are contributing to when we work longer hours, when we decide to, not support not support better payment for employees, or not advocate for wage shifts to our employers, when we don't take our vacation times and our PTO, because all those things contribute to the consciousness that the people who we serve are suffering from. I like to remind people that people have literally died for us to be able to have weekends and for us to be able to take PTO. And that is a great reminder for me whenever I'm having a hard time going, well, I just need to get this note done, and then I can cook dinner, and then I can do all these things. And it's like, wait a second. I don't have to do my notes on Sunday, which is, on my day off. I need to take space and take this weekend and start to slow things down. And that can be, for me, when I'm trying to bootstrap, I noticed even just last week, I was like around 4 o'clock, I had this horrible headache because I was trying to push past 4 p.m. And I was like, wait a second. Again, my ancestors have been fighting for my right to leave work on time. My ancestors have been fighting for my right to be able to have the opportunity to be present with loved ones, and to be able to live a life outside of work. That doesn't mean that I, don't love what I do. It's just, it can't be everything. So this is where it gets a little bit more participatory. Within the chat or verbally, I'm curious about what y'all think work is supposed to be. So when you think about work and your ideas of what work is, what do you think that work is supposed to be? Give a couple more moments for people in the chat. Oh, I love this. One of you put in, and I'll, one of you put in, you don't need to work, work needs you, from a book. That's so cool. Working to pay bills, bringing value to people's lives. I'm seeing survival, passion, contribution. One of you, look to the employer piece, which is next, and not necessarily seeing those values aligned, particularly because of low staffing, right? And what is happening in the culture of our field that is perpetuating low staffing, and how much pressure do we need to put on them in order to shift that? Because if we don't show up, if we're done, something's going to have to change. Yeah, loving talking about one of you's going on a trip, a significant trip soon. That sounds awesome. So for you, when you think about your employer, does your employer's values align with your ideas of work? Right? What do they do? What do they show that they value? I had to look at this specifically, even with my own business. My business was not valuing my weekends for a while. It's like, ooh, I'm a bad employer to myself. I need to shift some things. I was working like every single weekend and then like replying and oh gosh, it was terrible. I'm like, I'm a terrible employer to myself. Jeez. My employer who I was working for before was a better employer than I was to myself. I was like, yeah, just take another one and take another person for free, no problem. And I have control over that. Like what kinds of internalized capitalistic ideas do I have? I'll give a couple more minutes in case anyone wants to put something in the chat, and we'll go ahead and move on. That's so cool. We have a person who actually has an employer who values support. Yay! Love that. That human connection, the morning check-in. Oh, that's fantastic. So the next piece is getting in touch with our values. So I want you to identify what are 5 areas of life that you value. This could be personal growth or art or family or whatever. Just want you to identify, and you can either say aloud or put in the chat, what are 5 areas of life that you value? And the next question I have is, how much time are you spending in those areas versus how much time you want to be spending in those areas? How much time does TikTok take out of those areas? I'll give y'all a couple of minutes before we move on. Yeah, one of you talked about valuing family and outdoors and social interactions. along with some really cool interests.
These are great questions, Sazi, because I'm really getting a chance to stop and reflect about, I say I value these things, but how am I actually living out my values?
Mm-hmm. Yeah. Oh, I love this. Yeah, family, spirituality, career. We can have career in here, y'all. Like that is a-okay to value career. I love it. And nature. Oh, I love this like nature and health theme that y'all have going on. I love the idea of finding joy in activities. Yes. Love that stuff. So, just considering there's a difference between thinking about what your life would look like if you got a bigger paycheck and lived in a nicer residence versus like, what would it look like if my life fully aligned with my values? How would I be living my day to day? Does my work satisfy some of my values? Does my home life satisfy some of my values? Am I leaning in one area heavier than another? And I want to shift that. These are really important questions for ourselves. We had another person. Oh, I love this. Building in outdoor time and commuting by biking to work. That's been something that I just put on my radar as well, because I still work in the office. So I was like, oh, I can actually bike now. I have a bike. Love that stuff, building in those little ways to start attuning to those values. So I love Kim Young. If you're not familiar, highly recommend anything from Kim Young. Oh, she's amazing. The Dope Black Social Worker. She's fabulous. And she did this great training where she talked about we need to stop asking people what their dream jobs are. Who the hell dreams of labor? And I think we forget that what we're doing is labor. It is laborious. It takes time. It takes emotional taxation. It's labor. So, right, you're more than your professionalism. Life is so much more than clocking in and clocking out. So, when we're thinking about practicing self-care at work, there are so many ways to do that. And the first thing that's important is we need to start shifting the responsibility of burnout from individuals for not doing enough yoga or breath work during your break, or you didn't take your lunch break. And it's like, well, you scheduled the client over my lunch break, or you scheduled the notes over my lunch break, right? What is the reason why? If that didn't happen and we end up doing the work anyway, why? Wait a second, why did we choose that? Is that because we're usually in a cycle of overworking? What's going on, and how is that cycle perpetuated? Is it perpetuated by previous employment experiences, kind of subtle pressures from the culture around us, ideas and traumas that we might need to work through of value, and how value is, how hard of a worker we are or whatever. Maybe like we're avoiding going home. There have been times in life where I was like, I want to avoid going home right now, and so I'm going to work later. And is there something else that we could do outside of working to take care of ourselves during those challenging times? So really looking at, it's not my responsibility to prevent my burnout as an individual, but it is my responsibility to make sure that my employer knows what's going on and that I am taking actions that support an employment, a culture and employment environment that supports health and well-being and self-care. So if things are low staffed, you're not the one who's the low staff. That's because we have issues with transportation, childcare, payment, long hours, intensive traumatic work that we're doing that prevent people from staying on. I worked for a place where we had a turnover rate about every 3 months. We'd have just new staff out all the time. And then I shifted to an employer where the turnover rate was 2 to 3 years. And it was totally different. There were people like, it wasn't, and that was only because like the whole, from the top down, the program got shifted. And so it wasn't even like our managers, they were great. We got our time that we needed, very flexible. It was awesome. So it really, at least for me, helped me shift, oh, wait, this is what burnout prevention is. This is how we're being taken care of. Negotiate your salary and your benefits. How many of you have been doing salary negotiations? So when you go to a job, how many of you are like, oh yeah, I'm definitely negotiating my salary and my benefits. I do it all the time. How many of you knew that that was even an option to negotiate your salary and your benefits?
I had no idea it was an option at first because I was so used to being told, you know, this is the going rate for you as a new grad. This is what we're willing and able to pay you. This is your tier.
This is your tier and you're stuck. Love that thing about being unionized. If you're already unionized, who are the union leads, the reps, to talk to about improving things? There are always ways to begin exploring how to move things forward. Love, like cultivating friendships. I was talking with a clinician who's super burnt out the other day about like this person wanted to show me pictures of their kid while we were like during a break and wanted to walk with me. And I was just trying to do notes during my lunch. I was like, oh, okay, like tell me more, right? And it's like work is for work and I'm supposed to work at work. I'm like, well, how many times do you want to be texting people? Well, all the time. I want to be like, I want to be, you know, connecting, and I feel so lonely and all these things. And then, you know, how are we blocking ourselves from creating those friendships? Because friendship building at work is is a huge factor to prevent burnout. So how can we build those relationships with one another? And, you know, how are you taking your breaks, your PTO? Are you saving up tons of PTO time and not taking it? You get 2 10s. Are you taking your 10s? Are you getting your lunch break, your 30? Are you taking it to actually take a break? And valuing humanity versus productivity, right? Outcome measures and We'll get those as long as we are supporting our staff and our programs. So we are starting to get towards the end of our presentation. We have our last 15 minutes or so. So I want you, let's see. What I had done before is I thought, okay, we could do breakout rooms, but we have a very, very tiny attendance. Yay, thank you all for coming. So I'm curious, amongst yourselves, do you want to look at practicing salary and benefit negotiation? Identities that you want to cultivate, or common beliefs that you're running up against that prevent you from self-care? Which one of those three would y'all like to do?
These are great options. It's hard to choose just one.
I think the last two are good for chat if people are not feeling chatty. They're good for, you can do it in a written format. Salary and benefit negotiation is hard, and it's very good for audio. We have a vote for the last one. Okay. Let's do the last one. So I want you to identify 4 beliefs that are preventing you from practicing self-care at work. And put them in the chat when you're ready. Or say them if you want to use your voice. Oh my gosh, y'all are awesome. No time. There's too much to do. Balancing child's needs and business needs. Oh yeah, too tired. Another for not enough time. Ooh, yes. Lots of pressure, time limits. Yeah, why bother? How helpful is this self-care thing going to be anyway? Will leadership even listen? Yeah, feeling greater responsibility than for your own time. Yeah, giving to others is more important. So if we look at the belief that there's no time or there's too little time, how can we restructure that belief so that we are acknowledging the time limits, right? When we're restructuring beliefs, we want to acknowledge that it's happening. We're not here just, go out the door. So how can we acknowledge it, but also shift it so that we're empowered? And this can be for each of your respective spaces too. I can set different expectations for myself and work collaboratively with other colleagues to shift expectations. I love it. Oh, yeah, deciding ahead of time how much time we'll spend on these challenging things, right? Yes, absolutely. One thing I noticed, So for years, I have been going over in sessions and I finally was like, okay, it's time to implement 50-minute sessions and to hold it, like to start wrapping up around 40 minutes so I can give myself that. It was the hardest thing ever, but I got to use it as a learning opportunity for my clients to say, you know what, I've been doing this for a long time. And I know I talk to you about setting boundaries all the time, but this is where I have not been setting boundaries. And so I am practicing this now. So you'll see a shift. And this is how you can go back when you've been overtaxing yourself. I gained 70 to 90 minutes back in my day. It was amazing. I was like, whoa. And like I required of like, you got to give me 30 minutes. And then when I was when I worked in crisis, I was like, show me how to document in the smallest amount possible and the quickest way possible, and gain time back as well. So like when we look at how can we get other people on board, how can we empower folks, that there are so many ways to gain teeny tiny bits of time that add up. Love the 10-minute walk is better than no walk. Oh my gosh, that's so good. Oh, yes, I love this. Like, don't have the time and just put your coat on anyway. Oh, yes, and that makes such a difference because then our brains can actually process. And, you know, we get to increase our executive functioning, which happens between 10 to 20 minutes of walking. And then we actually are more present, for those of you who can walk. And there's so many other ways if you're unable to walk to start to reshift your brain and get it back on a better loop. I love these, y'all. So prioritizing your health, when you start to think of self-care being selfish, prioritizing your health is a form of activism. Just by being present with ourselves and our values, we are shifting the paradigm of what we expect for other people. And we're creating an expectation that we're going to take care of folks when they come into this field and help empower people who might be in other fields who we work with to start advocating for themselves, and to help advocate for them when we need to. It looks like we have someone off mute. Are there any comments to this? All right. Yes. So I have a little meme here that says, everyone telling me to practice self-care by doing yoga to prevent burnout versus me realizing that I don't have to prioritize work and how to ask for a raise and more paid time off. So as we wrap up, I want you to identify 3 actions this week that you can do. So small actions. This does not have to be huge. As we know, tiny steps are life-changing. 3 actions this week to integrate some radical self-care into your life, and put them in the chat. Ooh, I love this. Yes, someone's not going to check work emails before finishing the morning workout. Yes, love that. Oh, not taking breaks at the desk. Yes. Oh, that's so good. A better caffeine system. On the commutes home. I love it. Yes. sitting outside and taking the full break. Yes. Oh, these are so good, y'all. Yes, thank you for the clarification, the tea to help keep awake. Oh, yes. Love it. Well, now you have a couple of things to help you in your toolbox as you shift into your next week. You have some grounding to, right? Those breaths that we take, that check in with our body, that's the, all right, and here we go to take a break now. So I hope that this was helpful and that y'all feel a little bit more empowered in the last few minutes. If you have any questions or comments, you can feel free to ask and share. But thank you so much for taking the time to be here. Y'all are amazing, and you can reach out anytime. There's my info there. And then if you're interested in the references for the presentation, I have them here as well.
Thank you so much, Sazi. And if anyone would like to receive any CEUs for attending today's event, I'm just going to paste the sign-in, sign-out forms into the chat box, along with the evaluation form. And you should be receiving your CEU within a week, your CEU certificate. If not, just let me know. And my daughter wants to come play with the computer now, so I'm going to mute myself.
Awesome. Thank you all for showing up for yourselves today.
Yes, I know. Oh, I thought I muted myself. Sorry about that.
Great. So you can see there's the sign in and sign out form and the evaluation in the chat. Take care, y'all.